Good morning. My name is Angela Westhoff. I'm the President and CEO of the Maine Healthcare Association, and it is my distinct pleasure to welcome you to the 2025 Excellence in Long-Term Care Awards Program. The Maine Healthcare Association and the Maine Long-Term Care Ombudsman Program are pleased to collaborate once again on this year's program. Today, we celebrate the best and brightest in Maine's long-term care community. We honor caregiver dedication, performance, and all that you do to provide quality care across the long-term care continuum. From home care to assisted living centers to nursing facility care, we know that you, the caregivers, are the backbone and the lifeblood for Maine's older and disabled citizens. And it's our pleasure to honor you today. Before we begin, we have a few thank yous. First, this program would not be possible without the following generous sponsors, and I'm going to ask you to hold your applause until the end. Affinity Care of Maine, Maine Veterans Homes, Genesis, First Atlantic Healthcare, Preferred Therapy Solutions, Scarborough Terrace, and to our annual sponsors, Cisco North New England, Cross Insurance, Medline, and McKesson. And if you have representatives in the room, please stand for a round of applause. Thank you. Excellent. Additionally, I'd like to thank a few individuals for their important contributions to making this program an annual success. First, I would like to thank our 3 judges this year, and they had a very difficult task, sorting through over 78 nominations for the program. So while we had 3 judges, only one's able to be here today. I'm going to ask him to come to the podium to receive a small gift. First, I'll read their names. Fred Fowler, Volunteer Ombudsman for the Maine Long-Term Care Ombudsman Program. Brenda Peluso, Essential Care and Workforce Partnership Coordinator, Maine Council on Aging. And Megan Welch, Market Operations Advisor for New England for Genesis Healthcare. How about a nice round of applause? Thank you.
Thank you so much. It's thoughtful.
Next, I would like to thank our amazing staff at the Maine Healthcare Association. None of this would be possible without their efforts. Diane Chacoin, Anna Black, Mo Carland, Maureen Booth, Seal Robichaud, and Lori Delano. How about a round of applause for those hardworking ladies? I'd also like to thank our dedicated partners at the Maine Long-Term Care Ombudsman Program, Brenda Gallant and Nicole Marchese. I'd also like to give a big thanks to Eric and his team at Maine Video Marketing for running the live stream. This is so everyone at home can witness our winners being celebrated today, so thank you. I also want to thank the team here at Thomas College, including Darren and the hardworking staff for hosting our event this morning. And lastly, I'd like to thank Betsy Hopkins, Director of the Office of Aging and Disability Services, for being today's keynote speaker. Thank you, Betsy. Okay, I have just a few more comments, and then we're going to turn it over to some other speakers. So it's with brimming hearts and appreciation that we come together today to celebrate the exceptional achievements of 20 remarkable recipients of the 2025 Excellence in Long-Term Care Awards. We extend our heartfelt congratulations to these heroes, each caregiver whose work has been devoted to nurturing, comforting, and supporting the vulnerable. Direct care workers embody the essence of compassion and empathy, their hands and hearts offering hope to individuals navigating physical, emotional, and other challenges. Their dedication ensures that residents live each day with dignity and grace despite the hurdles they may face. This year, we were fortunate to have received over 80 nominations, and our panel of 3 judges diligently reviewed each application to select today's 20 honorees. Each worker's story was touching, but today's awardees best demonstrated great care, kindness, and a commitment to going above and beyond. I'd also like to thank the staff who took the time out of their busy schedules to research, write, and submit a nomination about their colleague. That act of kind and thoughtful leadership has clearly made a difference. If it weren't for you, we would not be here today to celebrate your peers. So your consideration for others is inspirational and surely motivates your team to provide the best care. Once again, congratulations to today's honorees for this well-deserved recognition. We are honored to acknowledge your exceptional care. I eagerly anticipate witnessing your continued success, and I know that your dedication and compassion will continue to make a lasting difference in the lives you touch. We couldn't have organized this event without the support of others. Thank you again to our many sponsors for making this all possible, and thank you to LitCop for co-hosting with us. With that being said, I'd like to ask Nicole Marchese, Public Policy Advocate of the Maine Long-Term Care Ombudsman Program, who's standing in for Brenda this morning, to join me at the podium. Thank you.
Good morning. Can everyone hear me? Yeah. Okay. Good morning, everyone. I am so pleased to be here on behalf of the Maine Long-Term Care Ombudsman Program to honor this year's Excellence in Long-Term Care Awards recipients. This is the 23rd Annual Excellence Celebration that was established by the Ombudsman Program and the Maine Healthcare Association because we wanted to do something in appreciation of Maine's outstanding caregivers. This special event is just one of many initiatives our agency has accomplished together. Every year, this is such an inspiring event held to recognize the amazing staff who give so much every day in providing care for older and disabled individuals in long-term care homes and home care. Each of you do work that truly matters. As advocates, we hear so often how important you are to residents and their family members. The caregiving you provide requires great skill, patience, kindness, and dedication. Each of you were chosen for this Excellence Award because of your leadership, your commitment to quality of care, quality of life, and resident rights. You are truly exceptional. You deserve our deep appreciation for all that you do. So thank you so much for the difference you make each and every day. Thank you.
Thank you, Nicole. Next, I would like to introduce our keynote speaker this morning. Elizabeth Betsy Hopkins is the Director of the Office of Aging and Disability Services at Maine DHHS. Betsy has dedicated more than 35 years to advancing Maine's disability services system, including the past 6 years as ODE's Associate Director for Developmental Disabilities and Brain Injury. Before that, Betsy held several leadership roles within the Department of Labor's Bureau of Rehabilitation Services, serving most recently as Director of the Division of Vocational Rehabilitation. Please join me in welcoming Betsy.
Thank you, Angela. Just doing a quick sound check. Everything okay? I'm nervous of that loud noise. Good morning, everyone. It really is a pleasure to be with you today to celebrate and honor the outstanding caregivers receiving this year's Excellence in Long-Term Care Awards. Before we begin, I want to take a moment to thank each and every one of you for what you do, day in and day out, to care for Maine's older adults and individuals with disabilities living in our long-term care homes and facilities. I know that for most of you, this isn't just work. It's a calling. It's a reflection of your compassion, your dedication, and your deep commitment to the people you serve. And I know how hard this work can be. The last few years have tested us, all of us, particularly those of you working in long-term care in ways that no one could have imagined. Yet you've continued to show up with grace, strength, and kindness. For that, I want to personally say thank you. I also want to share from a personal place just how meaningful this work is. As my parents were aging, and especially as my mother began to decline from Alzheimer's disease, I saw firsthand how profoundly important caregivers are, not only for those they care for, but for the families who love them. There were days when my father and I didn't know how we'd manage. The uncertainty, the exhaustion, and the heartbreak of watching someone you love change in such difficult ways can be overwhelming. But then there were the kind, patient, skilled people who helped us navigate each day with dignity and compassion. They weren't just caring for my mother, they were caring for us. They listened, they reassured, and they treated my parents like family. Those experiences left a lasting impression on me, and one of the reasons I feel so strongly about supporting and honoring the people who do this work. So when I say I understand how important your role is, I mean that deeply. I've seen the difference you make. Now, through the eye of my new role as Director of the Office of Aging and Disability Services, I see your work from an even broader vantage point. Every day, I'm reminded that Maine is one of the oldest states in the nation, and our population continues to age. This means that the need for skilled, compassionate caregivers will only grow in the years ahead. Your work is essential, and it's foundational to Maine's future. The care you provide helps people live with dignity, connection, and purpose, and it sustains families and communities across our state. At ODES, we're deeply committed to strengthening and supporting this system of care, to ensuring that the people who do this work are valued, supported, and recognized for the professionals that you are. You are the heart of long-term care in Maine, and our shared mission depends on you. The individuals being honored today represent the very best of Maine's caregiving community. You are role models, professionals who bring heart and humanity to this work. You've shown exceptional caregiving, respect for residents' rights, leadership among your peers, and a first-rate work ethic. But beyond your skill and professionalism, you bring something that can't be taught: kindness, generosity, and pride in what you do. Receiving an Excellence in Long-Term Care Award means that you have taken everyday caregiving to a new level. You haven't just met standards, you've exceeded them. You've risen to extraordinary challenges, new regulations, infection control protocols, supply shortages, and ongoing workforce pressures that predate the pandemic and persist today. Through it all, you've continued to bring comfort, dignity, and joy to those you serve, and that is something truly worth celebrating. On behalf of Maine families, and as someone who has both personally and professionally witnessed the power of your work, I want to say thank you. Thank you for your commitment, your resilience, and your heart. You make a difference every single day. I encourage you all to take the time to read the bios in your program book. They're inspiring, full of examples of compassion, creativity, and perseverance that remind us of all why we do this work and why it matters so deeply. Congratulations to all of today's honorees, 20 incredible individuals who embody what excellence in long-term care truly means. Thank you again for all you do to care for Maine's older adults and people with disabilities. You are the foundation of long-term care system, and today we celebrate you. Thank you.
Thank you, Betsy. And on behalf of the team, we have a small gift for you. Okay, now let's get right to the celebrating part. This is the best part of the day. So we're going to proceed to the awards program, where we get to hear more about these amazing caregivers. Here's how this phase is going to flow. I will ask each designated speaker to come up to the podium to read the bio of the recipient. We'll then ask that caregiver to come forward to accept their award. Afterwards, they're going to head over to Diane's station, the photography area, to have their picture taken, and then they can head back to their seats. I will then call the next designated speaker, and the award recipient will join them after their speech, and the pair will pose for a photo, and we'll just keep repeating this process until everyone is recognized this morning. A couple of quick reminders. Before everyone leaves today, we do want all the award winners to come to the front to pose for a photo. We like to get a big group photo. It's so much fun. And lastly, because I'll forget at the end to tell you that we do have boxes for you to take your awards home. So when you check out at the registration desk, just ask for your box so you can get it home safely. All right, so here we go. We're going to begin. All right, here we are. So, without further ado, we're going to start. Our first winner, unfortunately, is not able to be with us this morning, but I'm going to call up Nicole Marchese from the Long-Term Care Ombudsman Program to read the bio of Wadad Ahmed.
Okay, can everyone hear me? Sorry, these are intimidating. Wadad, an exceptional caregiver at Community Home Health Care, embodies dedication, compassion, and resilience. Over the past year and a half, she's displayed an unwavering commitment to her client, Stuart, going above and beyond to ensure his comfort, dignity, and well-being. Wadad has remained a dependable, uplifting presence in Stuart's life, consistently showing up with professionalism and heart. One of the most powerful reflections of Wadad's impact comes directly from Stuart. She treats me like family. I feel safe with her here. She doesn't just help me, she cares about me. Whether it's preparing Stuart's favorite meals from scratch, advocating for his needs with respect and persistence, or spending extra time ensuring his home is not only clean but comforting, Wadad never settles for just enough. She approaches every task, big or small, with the same level of care and excellence. Her professionalism is unmatched, communicating clearly and promptly with agency staff, respecting privacy and boundaries, serving as a role model for other caregivers, offering encouragement and tips to new staff, and demonstrating true person-centered care. Wadad's commitment to preserving Stuart's quality of life is especially evident in the small, meaningful details, playing his favorite music, decorating for holidays, and patiently engaging in conversation to help him feel seen and heard. She understands that caregiving is not just about physical support, it's about emotional connection and dignity. In times of challenge, Wadad steps up. During a snowstorm, she drove her vehicle through difficult conditions to ensure Stuart wouldn't miss his medication or meals. When asked, she didn't stay home. She simply said, "He needs me. That's all that matters." Wadad is a lifeline, a companion, and a true advocate. Her dedication makes profound differences in Stuart's life and sets the gold standard for caregiving. She is more than deserving of this recognition, and we are proud to nominate her for this award.
Okay, thank you. Next, I'd like to call up Christina Berube to read the bio of Tanya Brewster.
Good morning. Throughout her 13 years with Montello Commons, Tanya has consistently gone above and beyond every day for residents and staff. One resident said, "Tanya is wonderful because she has been with me since I came here." Okay, sorry, where was I? Her resident said, "And because of her, it feels like home." Tanya goes above and beyond for her residents, with many of her residents sharing, "Tanya is one of us." Tanya takes the time to know the residents' likes, dislikes, and preferences. She often is able to tell if someone is in pain, sad, or just having a bad day. Tanya is willing to stop what she's doing to console a resident, make a cup of coffee, or get them anything that they need. Tanya's compassion and advocacy extend beyond the resident she serves, as she's always willing to help out other staff. Tanya works hard to set up other shifts for success, making sure everything is stocked, clean, and ready. Her coworkers report that Tanya cooks food for them, provides direction when needed, and is honest, and they all rave about her good sense of humor. Many staff rely on Tanya for guidance and support. Okay. not awkward. Sorry. Tanya has been known to tell her coworkers, "I want you to call me, check in with me, so you don't make a mistake." Tanya is the go-to person for orienting new staff. Her strong leadership skills and keen eye for organization ensure new staff learn the ropes at Montello Commons, including what is expected of them, how to treat residents, and the rules and regulations. As a new supervisor to Tanya, I have learned many things from Tanya. Most important lesson she has taught me is to prioritize the needs of residents, ensuring they feel valued and respected. Tanya is an exceptional employee to work with and a great advocate to our residents, their family, and our staff.
So we'll have you pose with Christina for photo. Or just together. Sorry.
Let you bring your award to make sure.
There you go. Okay. Perfect. Head over there. Okay. Well, it's always challenging to go first. So thank you, Christina, for bearing with us as we work out the audio. And congratulations to Tanya. Okay, so we're going to move on. Next, I'd like to call up Sarah Newt, who will read the bio of Rayanne Burgess. Let's see. There we go.
Working with Rayanne is nothing short of a delightful gift. Each day, she bursts through the doors, joyfully dancing, infusing the atmosphere with an exuberance that lasts throughout her shift. She began her journey at the Barron Center in 2004 as a housekeeper. Even back then, it was evident by the care she took transforming residents' rooms into inviting spaces that Rayanne was going far in her career. In 2019, she took her commitment to the next level by completing the activity certification course and officially became a life enrichment assistant. And a year ago, she took on the role of training a new colleague. Rayanne's unwavering dedication to service transcends the boundaries of her job description. While some might say that's not my job, Rayanne constantly seeks to go above and beyond, expanding her skills in the process. Rayanne makes it her mission to connect with the newcomers and their loved ones. She warmly invites spouses and partners to join in community outings and celebrations. To ensure couples can strengthen their love, she helps plan special events like a Valentine's Day luncheon and apple-picking dates. Rayanne is described as very patient, embodying the spirit that ensures she makes a profound difference in the lives of those around her. The new staff person whom she recently trained said, Rayanne presented each resident as a real person, suggesting ways to interact with them as well as their activity interests. She wove in helpful tidbits, facts, and very important lessons throughout my early days while also being open to my contributions. Rayanne's sacrifice to work at the Barron Center means the world to the residents, their families, and to her fellow staff. She's willing and dedicated to giving her time and energy to enrich our lives, and that is the true essence of compassionate caregiving.
We're getting it down now. Okay. Maybe not. Perfect. Next, I'd like to call up Kara Brooks to read the bio of Josie Chase.
Our activities director is the heart and soul of our community. With compassion, genuine care, and an unwavering commitment to enriching the lives of our residents, Josie goes above and beyond every single day. She embodies what it means to truly care, not just as a professional, but as a human being. Her dedication to our residents doesn't end when her shift does. She often comes in on her own time, checking in, lending a hand, making sure no one is overlooked, and ensuring every resident feels seen, heard, valued, loved, and empowered to live life to the fullest. She spends Christmas, New Year's Eve, New Year's, Easter, Mother's Day, Father's Day, and most all other holidays to make sure the days are special for all of our residents. This isn't just her job, it's her calling. Her ability to create engaging and meaningful experiences reflects a true understanding of the diverse but unique needs and backgrounds of the individuals we serve. She leads with empathy and fosters joy through creativity. Whether it's coordinating multicultural celebrations, therapeutic recreation, stimulating cognitive games to music therapy, fitness, and personalized one-on-one engagement, or simply offering a listening ear, every program is designed to meet the unique needs and preferences of our residents. Her dedication makes a lasting impact on everyone she encounters. Josie does more than plan events. She builds relationships. She brings residents and staff together through activities which embraces unity and understanding. Whether it's a themed celebration, interdepartmental games, or a simple afternoon of shared group activity, she creates opportunities for residents and employees to connect in the most meaningful ways. These moments go beyond recreation. They strengthen trust, break down barriers, and transform our facility into a true home. Her leadership encourages staff to participate, engage, and grow closer to the individuals who live there, not just as providers, but as fellow human beings. The result, a workplace filled with warmth, laughter, and mutual respect, with a community where everyone feels like they belong. Josie's energy inspires both residents and staff alike, making our facility not just a place to receive services, but a vibrant, connected, and loving place where our residents don't just live, they thrive. We are proud to have an activity director who brings such warmth and creativity to every moment. Our residents rave about the activity's programming because it's more than just entertainment. It's about connection, purpose, and happiness. Our home is stronger, warmer, and more connected because of the selfless dedication our residents and staff feel every day.
That was inspiring. Homes where residents don't just live, they thrive, right? Isn't that what it's all about? Next, I'd like to call up Janelle Tompkins to read the bio of Richard Clift. Unfortunately, Richard's not able to be with us today, but we're going to celebrate him anyway.
Richard "Rich" Clift is an amazing example of excellence in long-term care. Rich has been part of the activities department at Maine General Rehabilitation and Long-Term Care, Glenridge, for 4 years. He has a remarkable approach with the residents, providing personal interactions that bring joy and a sense of connection. Rich's compassion and understanding are instrumental to the success of Glenridge's activity department. Rich's unique skill set, especially in his music prowess, brings joy and creativity for the residents involved in the Music and Memory program. The residents and staff love seeing him play his guitar, often at the request of residents. His music brings joy and uplifts during times of sorrow. Rich is highly respected by the residents, their families, and his peers. Families enjoy his regular and detailed communication, and we all get a kick out of his ability to bring modern technology to the residents. You'll often hear him encouragingly say, "With YouTube, you can learn anything." And he does just that, teaching himself some new tech resources to help residents recall their core memories. A family member shared, Rich treats the patients with the utmost respect. He truly cares and goes the extra mile for our family member without judgment. We appreciate his good sense of humor and authenticity. Glenridge is very lucky to have Rich on their staff. It's extremely difficult to have to place a loved one in a facility, but it's people like Rich that make it a little bit easier knowing that he truly cares. To say that Rich is an asset is an understatement. He is always looking for new ideas to engage the residents, whether it be a fun culture activity, a hobby, or relationship building. He finds the right activity to help residents meet their maximum potential. The activities department is a better team because Rich is an invaluable member, and he is very supportive in all of the department's endeavors. Thank you.
Thank you, Janelle. There we go. Thank you. And next, I'd like to call up Sarah O'Sullivan to read the bio of Angela Friend.
One of the most rewarding aspects of the senior living industry is its genuine potential for upward career mobility, especially for women. It is with great pride and admiration that we nominate Angela Friend for this award, recognizing her remarkable journey, unwavering enthusiasm that has enriched the Scarborough Terrace community since 2009. Angela began her career as a dietary aide, bringing with her radiant sense of humor, deep compassion, and an innate drive to serve others. Her dedication and spirit quickly stood out, earning her a promotion to dining lead, followed by a transition to activity assistant in 2014, and ultimately activity director in 2018, a role she continues to thrive in today. Angela leads a team of merrymakers, always dreaming up new ways to spark joy and connection. Whether it's themed events, spontaneous hallway parades, or heartfelt one-on-one moments, Angela's creativity and warmth are the heartbeat of our community, and her love of games, puzzles, and word searches are infectious, along with her willingness to try anything, especially baking. She's become kind of legendary. Several times a week, she attempts to recreate a resident's cherished recipe, often resulting in delicious but not recognizable dishes. One of our residents, Mrs. Esposito, who's very sharp-witted, she's from Long Island, New York, and she put it best. Angie is an angel, but a baker she is not, yet. Angela's impact goes far beyond her job title. She creates spaces where people often feel seen, valued, and joyful. Her leadership is rooted in empathy, her work ethic is unmatched, and her presence is a daily reminder of the power of kindness and community. We can think of no one more deserving of this recognition than Angela Friend.
All right. Thank you, Sarah. Just for the next presenters, we've learned that when we do the photo right here, we're blocking the live stream from home, so we're just going to skip that part and go right over to the professional photography area. And I would also say at the end, feel free to bring your teams up to take pictures. The backdrop will be there the whole time, so have no fear. We'll get the social media post. We'll help you do it. All right. Next, it is my pleasure to call up Jessica Porter to read the bio of our next winner, Joyce Gagnon.
When asked who should be nominated for the Excellence in Long-Term Care Award, one name was shouted out, Joyce. Joyce Gagnon, she's a rock star. She is a rock star due to her work ethic, personality, patience with mentoring new staff, and her dependability. Joyce is a seasoned CNA who joined us in 2021 as a one-on-one for a specialized behavioral health case. After 40-plus hours on the overnight shift, Joyce would stay and care for her mother, who was a resident on our long-term care unit. Eventually, Joyce would go home, but she would return before her shift and clock in. And before she clocked in, she would go back to her mother's side, visiting and providing her care. Joyce believes strongly in showing up, giving it her all to our residents and our team. She is often heard saying, they deserve our best. After her mother passed away, we feared Joyce may want to retire, but thankfully she stayed. She knew the specialized case needed her support. Our specialized case resident would often say, you know, for a little French lady, She doesn't let me get away with anything. But I love her. When the resident ended up in the hospital, Joyce would ask permission to go visit and check on her. When the resident graduated, Joyce was the first resident to volunteer to pack up her items into her personalized car and deliver them to her new group home. Both the resident and I had a sneaking suspicion that Joyce wanted to make sure her new room was well organized. There were smiles, hugs, and tears as Joyce wished our specialized case the best of luck on her new chapter in her life. Joyce was a large part of this person's success in our community. After this resident left, we once again thought Joyce may consider retiring, but again we were thankful she wanted to stay on our team. Words cannot express how grateful we are for Joyce Gagnon. I wish I could clone her 100 times. She is a keeper.
Okay, thank you. Next, I would like to call up Carrie Pelletier to read the bio of our next winner, Courtney Gold.
Hello. I have had the pleasure of working with Courtney Gold, RN, for 8 years at the Midcoast Senior Health Center in Brunswick. Courtney is the nurse supervisor for memory care at the Garden, overseeing 15 staff members, 17 residents, and countless family members. Courtney's coworkers describe her as always willing to help out, a caring leader who is kind, humble, and approachable. There is no doubt that Courtney's skills, deep compassion, and remarkable ability to connect with each resident are why she always scores as a best in class in all areas on the Pinnacle survey, and why her staff engagement scores are some of the highest at Midcoast Senior Health. Courtney's natural warmth and sense of humor bring comfort to residents, especially on tough days. Her caring demeanor helps them feel safe and understood, which is invaluable in a memory care environment. The family member of a resident sums it up best, describing Courtney's care of her mother, saying, "Courtney takes the time to truly understand my mom's needs, and the other residents too, their personalities and their backgrounds. This family member has experienced Courtney's special ability to treat residents as the unique individuals they are, and she cares for them as such." What's also striking is how Courtney seamlessly balances the demanding administrative tasks of her role while consistently spending time with the residents and staff. Her leadership in the Garden is exceptional. She keeps things running smoothly behind the scenes, but never loses sight of the personal connections that make the Garden so special. Courtney truly makes the Garden feel like a home for the residents, for the families, and for her coworkers. Thank you, Courtney, for all the love and dedication you bring to the Garden each day. You are a true gem.
And next, I would like to call up Deanna Morton to read the bio of our next winner, Michael Hawley.
Okay, I'm probably the shortest one here today. Right. Mike Hawley lights up the faces of the residents on our long-term dementia unit at South Paris Maine Veterans Home. He sets the standards of excellence, inspiring his colleagues, bringing joy to the residents, and instilling a sense of confidence in the families of our residents. Mike consistently goes above and beyond to provide exceptional care to residents, always treating everyone with dignity, empathy, and respect. His ability to connect with the residents and their families fosters a sense of trust and comfort. Recently, the spouse of a resident reported that from day one, her husband had a bond with Mike and that he felt safe with him. This is the highest compliment a family member can give after making the hard choice of moving her husband into the dementia unit. More times than I can count, residents have asked to speak with me just to make sure that I am aware that Mike is the best around. One resident made it clear to me that Mike should be training all of our new CNAs, exclaiming, "Mike knows what we need and how to make it happen." As true service leader, Mike supports and provides mentorship to staff with patience, integrity, and creating a working environment grounded in teamwork, accountability, and continuous improvement. His innovative contributions have led to high resident and family satisfaction and increased residents' participation in activities, significantly impacting the quality of life and care outcomes. Whether advocating for his residents, supporting families, or making residents smile, Mike has consistently demonstrates what it means to provide care from the heart. His exemplary service truly embodies values of this award, and MVH South Paris and myself really truly honor him and are grateful that he is part of our family at MVH South Paris. So thank you, Mike.
I don't even follow my own instructions. Okay, next we have two ladies we'd like to invite up. Ashley Ann Zioli and Allie Neal Moore will read the bio of Katrina Hedgepeth. Come on up.
Katrina consistently goes above and beyond in her role. She doesn't simply provide care, she delivers person-centered care with a rare attentiveness to the small, meaningful details that matter most. One team member shared, she takes time to do the little things, talking, sharing, engaging with the residents. In an environment where time is precious and demands are high, Katrina manages to prioritize human connection. Her presence on the floor is a source of reassurance. As one nurse stated, when she's working, I know the residents are cared for. It's a relief. That sentiment captures the reliability and trust that Katrina inspires amongst her colleagues. She brings calm, steadiness, and an unmistakable sense of purpose into every shift. Katrina is deeply committed to ensuring residents are not only safe and comfortable, but respected and seen. She takes no shortcuts in her care. Every task, from ensuring hydration to assisting with ADLs, is performed with thoroughness and grace. Even when the day runs behind, she doesn't let that stop her. Another coworker noted, if work has gotten behind, she will put forth the effort to make sure the residents are cared for, such as giving an extra shower. Her priorities never waver. Residents first, always. What makes Katrina truly stand out is the way she uses her calm demeanor, warmth, and good-heartedness to nurture one-to-one connections. She listens to stories, holds hands, shares laughs, and treats every resident as the unique individual they are. In a field that often moves too fast, Katrina slows down just enough to make a lasting difference. Her excellence doesn't shout, it shows up in the quiet moments.
the smiles she draws from a resident, the dignity she restores through her care, and the example she sets for those around her. Katrina Hedgepath is a caregiver and reliable teammate in the everyday rhythm of long-term care with consistency, integrity, and heartfelt compassion. Thank you, Katrina.
And I like the quote, "In a field that moves too fast, Katrina slows down to make a difference." Okay. All right, we're on to the next one. We're already there. Next, I'd like to call up Wendy O'Connor to read the bio of our next winner, Kim Horton.
Hi. Morning. First, I'd like to say Home Hope and Healing has two agencies. It has the medically fragile pediatric clients that we try to keep at home. We also do the personal care, so veterans, senior citizens, to help keep them at home as well. Kim works on the home health side, and she has been a nurse for over 4 decades. She also went through the nurse practitioning program. She is a dedicated member of Home Hope and Healing for the past 9 years. She is a prime example of commitment, compassion, and unwavering role model in the fields. These nurses go out to schools, they go to providers' appointments, they go to therapies, they travel everywhere with their clients to help promote and advocate for the things that they need and support the families. Kim goes above and beyond to meet the needs of her client. She consistently advocates for their care by reaching out to the providers, navigating complex systems, and securing essential medical supplies and equipment, often before anyone even knows that they are needed, including the family. Kim embraces some of the most medically complex clients, including those that require tracheotomies, ventilators, post-surgical care. She approaches each challenge with determination and grace and a tireless drive to ensure that her clients receive the highest quality of care. And I do want to add that Kim, a couple of months ago, was in the emergency room because she was extremely ill. I was checking in on her, and her only thought was to give me a list of things that needed to be done for her 2 clients. I had to ask her to please take care of herself, please stop talking, because she could barely talk, and get some rest, and I'd check on her later. When we are faced with workforce challenges, Kim has no problem stepping up to cover shifts, mentoring new staff, and taking care of all of her clients, and also showing the new staff how to go ahead and advocate and take care of her clients as well. She listens closely to their needs, honors their preferences, and ensures their voices are heard in every step of the care that she provides. One particular heartfelt moment that illustrates Kim's impact comes from the parents of one of her pediatric clients. They shared that Kim has been a godsend to their child. Without her dedication and motivation, our child would not be where they are today, both clinically and developmentally. This is the feedback that we hear ongoing in terms of the lives, the families that Kim touches. And I do want to just say that, give you an example. There was a 1.5-year-old that was born in the hospital and couldn't come home. He was medically fragile. He was on a vent, on a trach, and in order to get him home, our goal was to get him home for the following Christmas, was that we needed to have nursing services. So we worked hard for that. Eventually, Kim came on board and went through the whole process with the family to work with them with their medically fragile son, work on the trach, the vent, the respiratory care. He had a Mickey button. He was nonverbal. He continues to be nonverbal, and completely developmentally delayed. At the age of 2, he couldn't even sit up. So today he is 5 years old, and he is decannulated. He no longer is on the vent. He had trachea surgery. He now walks. He still can't speak, but he now is in daycare with his little backpack with a pump for his feeding tube. And that is a testament to how hard Kim works with the client and the family. In every way, Kim Horton embodies the spirit of this award. Her years of dedication, service is exceptional, and her commitment to excellence makes her shine, a shining example of what the long-term care is all about in terms of keeping families at home. And she is a trusted nurse, a compassionate advocate, and a true role model for all of us in the field. I do want to point out that, unfortunately, our chief officers and the owners of Home, Hope, and Healing couldn't be here. We have a significant cyber attack. But they do want to send their love to Kim and thank her for her years of services and everything that she does for her clients and her family. Thank you.
Thank you very much. Okay, and next, I would like to call up Patty Nutting to read the bio of Sandra Illingworth.
Sandy has made an exceptional impact at Maine Veterans Home in Scarborough. For the past 14 years, she has dedicated herself to serving as a speech and language pathologist and sharing her expertise and leadership in dementia-capable care to enhance the lives of our residents. Sandy's skill set has allowed her to be on the forefront of best practices for many years. She started off by establishing the evidence-based music and memory program, and then moving on to lead a Parkinson's support group, which provides resident and family education, peer-to-peer support, and staff awareness about this diagnosis. Sandy also instructs and trains new staff through the Crisis Prevention Institute, ensuring that our teams understand the compassionate care that's necessary for the residents with a dementia diagnosis. But perhaps her most impactful work has been accomplishing her long-term goal of establishing a dedicated dementia team within our facility, focused on providing ongoing education and developing specialized programs for our residents. Sandy actively mentors, supports the interdisciplinary team, helping them grow their skills and strengthen their ability to provide exceptional care for our residents, especially those who may experience behaviors that interfere with care. Through her leadership, compassion, and dedication, Sandy has helped ensure that our residents receive the highest quality of care possible. Recently, a family member of a resident who participates in the Parkinson's support group commented on Sandy's patience and ability to build rapport with all the residents, noting that no matter what, Sandy listens to the residents, she is flexible, and she helps everyone feel heard, supported, and cared for.
Sandy is a strong role model for all staff at MVH because of her compassion, strong advocacy for the residents, initiation of support groups, active involvement in committees, and her unwavering focus on resident dignity and quality of life. Thank you, Sandy.
Okay, and next I'd like to call up Tammy Polk to read the bio of Lacey Calick.
Good morning. Lacey's been an integral part of Maine Veterans Home HI's team for 8 years, starting as a per diem CNA, CRMA in the nursing department and working her way up to social worker. Lacey strives to attain the highest level of quality and satisfaction while delivering person-centered care with competence, compassion, and commitment. Even prior to admission, Lacey is connecting with the potential residents and their family, answering questions, setting their minds at ease. It is her ability to build a strong rapport and the kindness she displays that sets her apart. Families rave about Lacey, commenting that she helps make sure residents are treated as individuals, like buying favorite treats, powdered sugar donuts, and by coordinating visits and special family events, including a recent 100th birthday celebration. Her care and compassion extend to her coworkers too. As the wellness coordinator, Lacey works to make sure her coworkers are healthy, providing nutritious snacks and recipe ideas, knowing that a healthy staff is a happy staff. Other staff are inspired by Lacey's efforts to always go the extra mile, be it with her punctuality, her willingness to help others on shift, or by coming up with new ways to ensure residents' safety, like when she introduced the idea of purchasing cup holders that attach to the residents' walkers to prevent spills and slips. Whether she is supporting the resident through a difficult transition or empowering a family to make informed decisions, her work is driven by heart and passion for her job. She exemplifies the MVH core values daily, and we are incredibly fortunate to have her on our team.
We went too far. There we go. Okay. Just not working? Okay. Nope, too far. Okay. I'm just going to stop touching things. Thank you, Erica. Next, I'd like to call up Michael Lacasse to read the bio of Tanya Kennel.
Tanya was hired as a housekeeper in 2021. Tanya immediately became an invaluable team member of Schooner Memory Care. Quickly promoted to her current position as housekeeping supervisor, where she trains and supervises a staff of 4. Her co-workers and supervisors talk about Tanya as dedicated, hardworking, a team player who consistently demonstrates her passion for residents. The maintenance director notes that Schooner Memory Care would not be the same without her, especially as she is an integral in getting rooms ready for new residents and preparing the building and grounds for seasonal changes. In addition to her maintenance duty, Tanya helps the clinical and dietary staff after her regular shift. Tanya inventories and organizes clinical supply closets and communicates ordering needs with the purchasing agent. She also organizes and files past medical records to ensure easy access. Her willingness to support across departments exemplifies true commitment to her well-being of our residents and the success of our community. Staff, residents, and family all appreciate Tanya's smile and consideration. She knows everyone's coffee order and brings flower arrangements. Tanya plays an invaluable role in the first impressions families have when touring. Her commitment to cleanliness and attention to detail constantly comes up in conversations with prospective residents and their loved ones. Families often comment on how welcoming, fresh, and well cared for our environment feels, and that's a direct reflection on Tanya's dedication. Her work not only elevates our standards, but helps build the trust and confidence families need when making such an important decision. Tanya makes sure to spend time getting to know each resident and family members, some whom consider her family. Tanya's dedication to her responsibilities and pride in her work is noteworthy. Her extraordinary, kind, and encouraging disposition ensures she treats residents like family, while taking a personal interest in them and attending to their needs to promote their well-being. Schooner Memory Care is better because of Tanya.
And next, I'd like to call up Nancy Marcille to read the bio of Diana Lehman.
Hi. Deanna is the heart and soul of elder care. She is responsible for the clinical care in 5 homes that make up the elder care network of Lincoln County, known locally as the Greens. As the clinical care coordinator, Deanna's mission is to provide loving elder care for low-income elders, allowing them to stay in the communities where they have lived, worked, raised families, and given so much of themselves. One of her great joys is getting to know everyone during the admission process. She puts people at ease, often fostering trust and connection that quickly results in shared coffee, laughter, and a sense of relief. For many of the residents, she becomes a well-loved adopted daughter, someone special they share their happy times, fears, and dreams with. Deanna's attention to detail and her fun personality can be seen when she's preparing rooms for her new residents, a task she lovingly refers to as fluffing and buffing, or shopping for special curtains and correctly coordinated colored beddings of the residents' choosing. She knows how important it is to personalize their spaces. Dee's day is spent dedicated to the needs of the residents. Sometimes it can start at 2 a.m. when beckoned to sit with a hospice resident who is having a restless night. Other days, she's creatively solving staffing issues or spontaneously creating a rambunctious afternoon game of cutthroat bingo, which everyone seems to love. She is a role model for all her staff and the residents, always leading and living by example, developing personal and unique relationships, making sure everyone feels safe, comfortable, and cared for. That is the essence of Deanna. Before passing away, a very dear resident told us, "I came to live out my days here, but I never expected to be this happy, which is because of you, Deanna, and your staff." Thank you, Deanna, for all you do. You're the best.
Fluffing and buffing. I like that. How do we sign up for that? Safe, comfortable, and cared for. I love it. And next, I'd like to call up Tara Rollins to read the bio of Daniel Martell.
Dan has been an invaluable member of the River Ridge team since 2016, serving as a dedicated rehab technician on our specialized acute brain injury unit. Over the years, Dan has worked his way up. He started as a rec assistant, then transitioned to dietary, and is now excelling in his current capacity as a rehab tech. His profound enthusiasm is constantly evident, as highlighted by the residents' commendation for his golden microphone during bingo. Dan knows how to make the everyday community reintegration task a lot more fun, taking great pride in helping residents regain and practice skills like baking, meal preparation, and vehicle cleaning by adding playful elements like water balloons to bring people joy, laughter, and an element of surprise. Beyond his technical proficiencies, Dan exhibits exceptional attentiveness to residents' behaviors, demonstrating a remarkable aptitude for de-escalating challenging situations. Dan is great at individualized engagement with residents, fostering personal connections through activities like Connect to 4, iPad bowling, and beanbag toss, and being able to give them the much-needed one-on-one attention. Dan also serves as a strong advocate for residents. Recently, he collaborated with the maintenance director to establish raised gardens within the courtyard, allowing residents to cultivate flowers and vegetables and observe their growth. He is recognized for his spontaneous pop-up events, which include barbecues and carnival-themed days, and consistently ensures that holidays are particularly special. For instance, Dan came into the center on his scheduled night off to host a New Year's Eve celebration, complete with a televised countdown thoughtfully arranged post-dinner to facilitate residents' participation in the memorable occasion. Dan's genuine satisfaction derived from witnessing resident smiles and his dynamic energy are precisely what the unit requires. We are very grateful for Dan.
Thank you, Tara. And next, I'd like to call up Tyler Parkhurst to read the bio of Mariko Murray.
There's just something about Mariko that makes this feel like home. This quote from her supervisor is often echoed by residents and coworkers who describe Mariko as having a calming effect on everyone she encounters, residents, families, and her peers. There is no shortage of examples of the positive impact she makes at our home. Originally from Japan, Mariko has been with Hibbard in rural Maine since 2016. For some, the culture shift would have been a challenge, but not for Mariko. She demonstrates an ability to adapt to any situation. Mariko enjoys taking her time to get to know the residents, cultivating trust, and building a strong rapport and relationship based on mutual respect. She has a keen knack for learning the unique nuances and personalities of the residents, so much that she knows their baseline and can quickly tell when somebody is deviating, enabling quick intervention. It's not unusual to hear staff saying, "I'm so happy that Mariko is here today." That's because her happiness is infectious. She sets a positive tone in the workplace and is always willing to help without being asked, stay late to cover a staffing need, and to show examples of what kindness can look like in long-term care. I am proud to have Mariko on our team. Many things come naturally to her that not only make her a great caregiver, but a great person. In particular, her ability to be patient, her work ethic, and her ability to help people rise.
Thank you, Tyler. And next, I'd like to call up Megan Mayu to read the bio of Nicole Ramsey.
Ooh. All right, so I have the pleasure of introducing Nicole Ramsey. So Nicole began with Piper Shores as a server when she was still in high school. Her bright and energetic personality and capacity for caring was really quickly recognized, and she soon advanced to a hostess position. So in her role, Nicole demonstrated excellent leadership and service, and her supervisor encouraged her to take a CNA training. Nicole completed the training in 2021, and in the thick of the pandemic, she joined our healthcare center team, providing care and service to our most vulnerable residents during the most critically challenging health event our nation has ever seen. Nicole takes the time to get to know each resident. She is the go-to archivist and remembers every resident she's ever encountered, warmly memorializing their lives. In her current role as CNA, CRMA, Nicole's regular responsibilities are within the memory care neighborhood. However, because she's a CNA, she can also on occasion be asked to lend a hand in our skilled care nursing home unit. When she's asked this, she never hesitates. She truly has a gift for working with residents living with dementia and is an incredible presence to the team. Her ability to connect on a personal level creates moments of genuine joy and comfort for everyone that she cares for. Always quick to assist, she is not only responsive to the needs of the individuals, but proactive in finding ways to uplift and support the entire team. Nicole has goals for her future and plans to enter a nursing program when her child gets just a little bit older. And we're certainly confident that her strong clinical acumen and her positive approach to all elements of care will make her an amazing RN or LPN. The healthcare community in Maine is better off for having her in it, and we are really proud to call her one of our own since 2015. Congratulations, Nicole.
See, violating my own rules. And next, I'd like to call up Lori Miller to read the bio of Nancy Shivert Page.
With more than 9 years of dedicated service in her role as the administrator, Nancy exemplifies the very best of leadership in long-term care. Her unwavering commitment to quality, compassion, and the integrity has elevated every aspect of our facility. Under her guidance, the Meadows has consistently surpassed regulatory expectations, met and exceeded quality assurance goals, and maintained high levels of resident and family satisfaction. Nancy leads with a steady hand and an open heart. Her calm, thoughtful decision-making and clear communication inspire trust and confidence among staff, residents, and families alike. She prioritizes continuous staff development and fosters an environment where every resident's dignity, safety, and well-being remain at the forefront of care. What truly sets Nancy apart is her resident-first philosophy. This approach resonates throughout the facility and forms every initiative she undertakes. In times of staffing shortages, Nancy does not hesitate to step in whenever needed. Whether it's in the kitchen, as a CRMA, or providing direct care, it's always with a smile and never a word of complaint. She leads by example and with humility, demonstrating time and again that no task is beneath her, even when it comes to assuring quality care. It's rare to find a leader who balances operational excellence with such genuine heart. Nancy is not merely managing a facility, she's building a community and storing lives with purpose and grace. For all these reasons and more, I'm honored to present Nancy with the 2025 Excellence in Long-Term Care Award. This recognition is fitting tribute to her extraordinary leadership and unwavering dedication.
She stopped me from doing it. We all need a little help. And last, but definitely not least, I'd like to call up Tab Newt to read the bio of Sherry White.
Market Square Healthcare Center would be hard-pressed to identify a candidate more deserving of recognition than Sherry White. Sherry, a dedicated medtech, joined our team in September of 2020 during the unprecedented challenges of the pandemic. Demonstrating her exceptional commitment, she expanded her role to include central supply and purchasing in January of 2024, showcasing her versatility and willingness to take on additional responsibilities. Throughout her tenure, colleagues have noted her cheerful demeanor, easily lifting the spirits of residents when they're feeling low, maintaining a sense of calm in difficult times, and consistently displaying an extraordinary level of compassion, kindness, empathy, and integrity. Sherry forms strong bonds with those she serves, earning their trust and respect through her attentive and compassionate approach, and often serving as a surrogate family member for residents who may be missing that personal connection, providing warmth and familiarity. During the passing of one of our residents, Sherry embraced her role as caretaker with a profound sensitivity. Sherry held the resident's hand and offered soothing words, providing a calming presence during a remarkably difficult transition. Her compassion at that moment had a lasting impact, not just on the residents, but on all of us observing her. In every interaction, Sherry brings a steady, reassuring presence that goes beyond the typical scope of her job. Whether she is providing medication, supplies, or simply an attentive ear, she makes it a point to engage with residents, ensuring they feel seen and valued, even if it means her daily responsibilities take a little longer to complete. Her genuine empathy and unwavering support are what truly sets her apart as an outstanding candidate for this honor.
Thank you, thank you. You know, I've read these stories several times, but it's always so touching to hear them in person and from trusted colleagues who have nominated their peers. So again, on behalf of the Maine Healthcare Association and the Maine Long-Term Care Ombudsman Program, we'd like to extend our deepest congratulations to all of today's recipients. And you know what? How about we stand up and give them a round of applause, a standing ovation. That's beautiful. Thank you. Thank you so much. A few announcements before we depart. First things, the flower arrangements on the table. We would highly encourage the winner to take them home with them or back to the office to brighten up the day of your residence, but put them on your own desk if you can. Also, before heading out today, just a quick reminder to have all of our honorees please come to the front for a group photo. We promise it won't take long and we won't make you pose too long. And final reminder, we do have boxes out at the front desk if you'd like to put your plaque in a box for safe travel. And I think that's it. Thank you so much for attending today. It's been a joy and a pleasure. Thank you. Safe travels.